Hello and welcome to the program. My name is Marie Yambo. Social media handles at KBC Channel 1 on Twitter, KBC Channel 1 TV on Facebook. We'd like to hear from you. Now, for many years, type 2 diabetes was considered a progressive and irreversible condition that required lifelong management. However, recent research has shown that it is possible to reverse type 2 diabetes through lifestyle changes such as weight loss, diet modification, and increased physical activity. Reversing type 2 diabetes not only improves blood glucose control, but also reduces the risk of complications such as cardiovascular and kidney disease. In this edition of Your Health, we will explore the science behind the reversal of type 2 diabetes and discuss the steps that individuals can take to achieve remission. But first, let's hear the story of Gladwell Kamau, who was diagnosed with type 2 diabetes. Take a listen. Today, I'm at Kahawa Wendani in Nairobi County, where I meet Gladwell Nyambura at her home preparing lunch.
Hapa ndio mimi natengeneza kulingana na vile sasa niliambiwa na daktari mambo ya change diet, because aliniambia sasa vitu hizi ndio sasa aliniambia niwe nakula sana, these are vegetables.
A healthy diet is something that Gladwell has taken very seriously. A year ago, she was diagnosed with diabetes type 2.
Nilianza na kuganda mkono, my left hand. Nilianza kutoka many years. Sasa mimi nilikuwa naenda, sasa nikienda natibiwa, sasa napatiwa neurobeans. Ndio mimi nikaonelea sasa pale imefika, this now sitaenda hizi normal medicine kwa medical. Sasa nikasema this time nitachukua hii jukumu niende nikaone daktari wa mifupa, orthopedic. Sasa ndio nikaintroduziwa na nikaelezwa kuna daktari mmoja akodhika anaitwa Dr. Peris. Akaniambia sasa kuna kitu ya kwanza niende nikafanyiwe kitu inaitwa ECG. Nikafanywa, nikamrudishia the result. Halafu sasa hiyo result akaniambia kulingana na vile ameona na anastahili kufanywa echo. Sasa walikuwa nachunguza, kwa maana nilikuwa nasikia ni kama na umwa na mgongo. Yaani si mgongo, na si unaona kama heart direct na huko hapa nyuma. Sasa down kwa soldier hapo unasikia kama kuna joint. Sasa ndio akasema kwa ajili unajua nisaidia heart. Sasa ikakuwa she became so concerned kwa maana it is on the left side, na vile mimi namueleza nasikia ni kama unajua hapo ribs. Pale lips iko unasikia ni kama unasikia uchungu. Akaniambia kulingana na vile the symptoms hizo zote niko nazo, akaniambia sasa hapa nitakutuma kuna test nataka uende ukafanywe. Aliniambia inaitwa HbA1c. Sasa mimi sikuwa najua nini. Sasa akaniambia saa zingine inadamananga na sukari, hiyo mambo inaweza kuwa inaletwa na sukari. Sasa mimi akanituma na akaniuliza kule nataka kwenda kufanya. Sasa nikamwambia nitaenda kufanywa town. Sasa wakati nienda nikafanyiwa the result nikaambiwa the result I come for the result the following day. Sasa wakati nilienda kuzichukua mimi nikasoma. Sasa mimi nikawauliza nini result hizi zinamaanisha nini? Juu zilikuwa zimeandikwa ati the result here walikuwa wameandika diabetes mellitus. Sasa kitu moja ni mimi nikastuka.
Diabetes type 2 is a non-communicable disease that is brought about by unhealthy eating habits and being overweight.
Sasa akaniambia sukari sana sana inaletagwa na hizi vitu kama starches. Sasa ndio alikuwa ananiambia vitu kama chapati, ugali, michere, yani hizo vitu, anything to do with the flour. Sasa ndio mimi nikamuuliza daktari, are you serious? Sasa mtu nikukula nini? Akaniambia gradually there are so many things you can eat. Sasa halafu nikaanza kumuuliza, na sasa tuseme kama ni dengu, tuseme kama hizo vitu, nikamwambia okay you can eat them, lakini unakula na mpango, usikule mingi. Kitu ile mimi nataka kwa sahani yako 3/4 ikuage ni vegetables.
For most patients, taking medicine is the only way to manage diabetes type 2. However, studies have shown that by just changing your diet, diabetes type 2 can be reversed.
In the morning I take bread, saa zingine nakula guashe, saa zingine na kama niko na duma nakula. Akaniambia kwanza hizo vitu. Hizo unasema hizo guashe, hizo unasema guashe, hizo sweet potatoes, hizo dumas, hata hizo siko na sukari sana. Kwa hivyo sasa mimi ningekuomba asubuhi, even if you, kitu ile mimi najua sana haina, those ni eggs. Kuna eggs, nyama, saa zingine unaweza kula, alikuwa anasema you eat eggs, even if you can eat even nyama in the morning, soup, those things. Halafu unaweza tengeneza takasubari, si uko na nyanya, those things you can make a salad, you can still eat those things. Na sasa wakati huo nilikuwa nasikia vegetables, sasa nilikuwa na shida sasa vegetables ni nini sasa ndio nikakuja kugundua these are vegetables.
She admits that changing her diet was not easy, but it was worth it.
It was not easy, lakini as I adopted that life, nikazoea. In fact, kwanza nikienda kwa daktari I was 91 kgs. Then after 3 months, now 6 months down the line, wakati sasa tumeachana na yeye, nilikuwa na 81. So unaona within 6 months nilikuwa nimeruhusu 10 kgs. Juu aliniambia even kilos zinasababisha sukari. Kwa hivyo sasa niangalia sana mambo ya kilos.
It's been over 6 months and her blood sugar, she says, is normal.
Last time nilikuwa kwake ilikuwa July. So sasa turudi tu pale kwa daktari. So wakati nilienda kwa daktari sasa tukaongea hii maneno yote, akaniput on medication for 3 months. Akanipea dawa inaitwa glucovage. Akaniambia gradual uwe unakunywa 1 per day. Halafu sasa uangalie mambo ya diet. Ukiangalia mambo ya diet, then after 3 months urudi tukuje tupime hii HB1C. Wakati huo sasa after when I was taking medicine, I was on medication, after 3 months kwenda nikapimwa ilikuwa 5.6.
So it had gone down.
Yeah, ilikuwa imeenda down. Na wakati huo sasa nilikuwa nakunywa dawa moja. Then after 3 months nikaambiwa, then from here now I'll give you 3 months without medication. Sasa nikaenda sasa ndio nikakuja nikakaa 3 months ndio nikarudi bila medication ikakuja 5.4.
And after listening to that story about Gladwell Kamau and how she was able to put type 2 diabetes to remission by just changing her lifestyle, we now want to talk to a specialist. Dr. Nicola Okech is an endocrine specialist. Let's hear from her on what that type 2 diabetes is and how to put it to remission. Thank you for joining us in the program.
Thank you for having me.
Thank you so much. So even before we delve into the diet, because it is diet-based, first of all, just paint for us a picture how the state of type 2 diabetes in the country.
So we don't necessarily have very hard facts, but what we do know is that about 3% of our population have type 2 diabetes. However, I must mention that most patients are undiagnosed. Mm-hmm. We are getting a lot of rates of type 2 diabetes being diagnosed in the young people. And this 3% is it's an underestimation of the amount of diabetes that we have. What we do know, according to at least the International Diabetes Federation, is that the rates of diabetes are likely to triple, more so in the African setting. So we are expecting a rise in type 2 diabetes in the next few years.
Okay.
Yeah.
Really, because of the, can I say misdiagnosed, or do you say underdiagnosis? I don't know how you call it.
Not necessarily. I think the main challenge is we are adopting more of a Western type of lifestyle. So more of a sedentary lifestyle, and even our diet has changed, so that predisposes people to developing type 2 diabetes.
Okay. And then, just like we said in the introduction, there's research that now shows that type 2 diabetes can be reversed. But for a very long time, type 2 diabetes has been managed using medication. Why did it take so long for the medical fraternity to actually, can I say, find out that actually it's a lifestyle disease, and so that means you can actually change it with lifestyle? Yeah.
So we've always known that type 2 diabetes can be reversed. Actually, the term that we now use is remission, because reversal is a bit of a complex term. So we've always known that type 2 diabetes can be put into remission. It's just that now it has been given a definite term, okay? But we know that not everyone is a candidate for remission. There are some people who have type 2 diabetes that we would prefer that they don't get off the medication. Yes.
Okay. Before I delve into, can I say, the hormone that is a culprit? I'm not a doctor, but I think insulin is the culprit. Before we delve into that, maybe you can just, in a brief way, just explain to us what type 2 diabetes is and how it comes about.
Okay. So in the medical setting, there are two kinds of diabetes, so we really have to differentiate. And in this conversation, we are talking about what we call diabetes mellitus. So diabetes mellitus is just a syndrome, which is a compilation of signs and symptoms that basically result, or rather come about as a result of abnormalities in glucose control. Okay, so that's essentially what we describe diabetes mellitus as. Type 2 diabetes, speaking specifically about that, comes about when there is a deficiency in the insulin. So insulin is the hormone that is usually used to regulate the glucose within the body. In patients who have type 2 diabetes, either they have insulin, but they have insufficient supply of it, so the pancreas does not produce enough. Or if they do have the insulin, the body does develop some resistance to it. So it can be either or a combination of deficiency in insulin and resistance to insulin.
Okay. Now, when you talk about resistance especially, what exactly do you mean? Because it doesn't mean you're deficient, but you're resistant, which means, is it that your blood sugar is not sensitive enough, or what does that mean?
It means the organs that perceive insulin do not recognize it. So the way the body works when you're regulating sugar, let's say for example in a normal person, you will take in your carbohydrates and then they will be broken down into glucose. So the glucose now enters the bloodstream. Okay, glucose is the main energy source of the body. So the cells of the body have to take this in to produce energy to be able to function normally. And insulin is the key that unlocks that entry of glucose into the cells. So when there is insulin deficiency, the body cannot recognize this key. It's entering like the wrong lock. So it cannot take in that glucose. And because it cannot take in that glucose, the body's cells lack energy. So they have to look for other sources of energy. And that's where you find that the sources of energy that are usually mobilized is the fat and the muscle. So they break down fat and muscle. And that sometimes you'll notice that patients who have diabetes for the first time during diagnosis, they will come to you with a complaint of weight loss. That's how it comes about, because they are breaking down fat and muscle. They are losing it.
So now let's delve into the crux of the matter. So research has now established that you can actually put type 2 diabetes to remission. I'm sure people who are watching, either affected directly or indirectly, may not really know, but it's all about the diet. Could you then talk to us what this diet is all about? Because it's a lifestyle change. It's a lifestyle change altogether.
So before going into diet, what I must mention is whenever we are putting patients into remission, most of our patients, we tend to start them on medication, initially on diagnosis, because most patients with type 2 will present late. They will present when the sugar has been in the bloodstream for almost 5 to 7 years, okay? So by the time we are deciding whether or not this patient is a candidate for remission, the patient has initially already been on some medication for a while, okay? and you have noticed that they are improving and their sugars are getting better. So you gradually wean them off the medication up to the point where you do not require medication, of course keeping in mind the targets that you want for this particular patient. So once you've been able to get them off the medication, and as part of diabetes care, we always focus on lifestyle. So lifestyle is the cornerstone of diabetes care, and then pharmacology, or rather medicines, are added on top of it. So the patient really has to have a strong lifestyle, grasp on their lifestyle, such that when they're off medication, this is now what is going to sustain them off the medication. So when we talk about lifestyle, as you mentioned, it's mainly diet and exercise. So when you're talking about diet, there are various groups of food that we advise our patients. Just like a normal person, you will have your carbohydrate intake, you will have your protein intake, and then you will have your fats, okay? So for patients who are being put into remission, we advise them to reduce their carbohydrate intake, okay? So there are various diets that have been studied. One is the Mediterranean diet, okay? So this one focuses more on vegetables and oils, okay, and low carbohydrates. And then there's what we call the DASH diet, which is dietary practices to reduce hypertension. And this one also focuses on more of a vegetable-based diet, more of a nuts and healthy fats, okay? Then alternatively, there are some clinicians who opt for what we call very low calorie diet or very low carbohydrate diet, okay? So these ones just mean that the amount of carbohydrates that you're getting in your diet is actually lower than what a normal person would take. And then there's the other option of having a high protein diet, okay? So there are various options that you can approach in terms of putting your patient into remission, but every diet is individual based. So you have to have a conversation with your patient as to what works best for them, because if I tell someone from the village to go and buy broccoli, they might not know what broccoli is. Exactly. So you have to work with what the patient is presenting to you, okay? So diabetes, management of diabetes is always a conversation between the clinician and the patient to have what works for them and to obtain a favorable outcome.
So it's not necessarily low caloric diet, because then I would be asking about the sustainability. For instance, if you go Mediterranean, which is more of vegetables, Kenyans, we are very attached to our ugali, and chapatis and all that. How then would you advise someone who, definitely you're not saying that anybody should actually try this without a doctor, yes, but how sustainable is this type of diet if somebody has to delve into it?
It depends on what your goals are for your patient. Different patients are different, so your approach will be different from one person to another. If, for example, I have a very obese patient, what I'm aiming for there is weight loss. So in such a patient, then I would opt more for the very low calorie diet or low calorie diet. And in that case, it's not something that I am going to tell this patient this is going to happen for the rest of your life, because what you're aiming for is around a 15% reduction in the weight, and then within a period of probably 6 months to a year, and then after that, then you can revert back to a sustainable diet that they can be able to manage for the rest of their life. So the goals are different for different patients. What we focus on mainly in remission is loss of weight, because we know that the more kilograms a patient loses, the more likely they are to reverse their high sugars, okay?
Now, time frame. When you talk about remission, so we'll actually touch on, it's not for everybody. Not everybody can actually reverse diabetes type 2. But what is the time frame if, let's say, a patient has come and you can actually tell, like, if they just lose about 15 kilos, like you're saying, what's normally the time frame for the remission to happen?
So usually we see around a year. By the time a patient has been off medication for a year, without needing to go back because the sugars are climbing back up, then you would say that patient is in complete remission.
Okay. Yeah, and you talked about something, and that is the weight. Why is weight such a culprit? Because somebody might say, okay, it's just loss of weight. That means I can actually go to the gym, eat as the way I've normally just been eating. As long as I lose weight, I'll be able to reverse it.
So weight is a main issue in type 2 diabetes because what we discussed, insulin resistance. And this is mainly the weight that is around the stomach area, the abdomen, okay? And we're not focusing on the fat underneath the skin. We are focusing on what we call visceral fat, which is the fat that surrounds the organs which are within the stomach area, the abdominal cavity. So the more of that fat that you lose, the less insulin resistant you are, and therefore the more likely you are to reverse your diabetes.
Can anyone reverse type 2 diabetes?
No, not everyone is a candidate for reversal. So the people who most likely will benefit from reversal are patients who are newly diagnosed, as long as they do not have complications. And by complications, I mean they don't have chronic kidney disease, okay? They don't have heart problems, okay? And they don't have any other issues that may complicate your reversal. Because at the end of the day, when you want to put a patient into remission, you want to remove all medications that would lower the blood glucose. For patients who have kidney disease or heart disease, we tend to also put them on medications for sugar that also work on the heart and the kidney. So it's unlikely that such a patient will be in reversal.
So, but the success rates are quite high in terms of somebody who is a candidate for remission of type 2 diabetes.
As long as they are disciplined.
Yeah.
Our patients who we put into remission always have to undergo psychological counseling, because you want to make sure that this patient is able to sustain that remission once you take them off. It's very traumatic to tell a patient you have to go back on medication. So you have to make sure that this patient is committed to staying on a diet and a lifestyle that will sustain them being on remission.
So it does not mean you've lost the kilos, you're in remission for 1 year, then you go back to your nyama choma and the rest. No, it will just come back. So this is total lifestyle change for the rest of your life, if at all you want to stay in remission. Yes. Now, last but not least, I know we are running out of time. There's always this very interesting analogy or idea that I got, when I'm doing my research. What is the relationship between your waist circumference and your health? Because just like you said, it's not the fat under the skin, but do you call it the
fat surrounding the organs that causes the resistance.
Just for people to understand. So if I see myself with a certain type of a tummy, then I could actually be a candidate for type 2 diabetes.
Yes. Yeah. So for women, this is now based on African. It's 88 centimeters diameter. That is the cutoff, and for men it's 102 centimeters. Anything bigger than that, then you are at high chance of getting these lifestyle diseases, diabetes being one of them.
So especially to our men, we should not mistake the kitambi, as we call it, for being wealthy, but it could actually be a sign of disease or something. I mean, putting yourself at risk of lifestyle diseases, type 2 diabetes being one of them. Thank you so much, Dr. Nicola Okech, for coming in and explaining to us about type 2 diabetes and even how to put it into remission. But remember, you cannot do this alone at home. If you're someone who's already been diagnosed and you're interested in putting your diabetes type 2 into remission, you must seek a doctor's advice. Thank you so much for taking the time to be with us on the program today. Indeed, a healthy lifestyle is key to good health. We hope to see you again next week. My name is Marie Yambo. Goodbye for now.